Hi, I am Dr. Veena Nanjappa, cardiologist from Sri Jayadeva Institute of Cardiovascular Sciences. I'm happy to be here at HFAI event edition 2025 at Kochi. I have been asked to speak on addressing the heart failure therapy, the way forward. So I believe that the burden of heart failure is increasing by the day. Worldwide, we know there are about 64 million patients with heart failure problem, and this is going to staggeringly increase with an Indian population of 1.4 billion and an incidence anywhere amounting to about 0.015. So I believe that way forward is to address the primordial and the primary risk factors at stage A level, because the burden of the disease is very high in our country and the resources are limited. It is said that above 50 years, close to about 1 in 4 or 5 men and women are going to be having heart failure. So that number is gigantic. So we have to train our resources to pick up the cases early, to treat the risk factors, and moreover to prevent the risk factors, which is diabetes and hypertension and ischemic heart disease, which is the most common contributor of heart failure in India. When you look at the NHFR registry of 10,851 patients, which was released in 2019, that's the largest Indian data on heart failure, 70% of the etiology was linked to ischemic heart disease, and thereafter by dilated cardiomyopathy, and a small proportion of it was rheumatic heart disease. So in India, ischemic heart disease forms a large part of the pie causing heart failure. So we have to train our resources to tackle this problem and also make sure the fantastic 4 guideline directed medical therapy, which includes the ARNIs, beta blockers, the SGLT2 inhibitors and the MRAs, the penetration to the population is that much more deeper. So when you look at the data, it is only about 4.8%. So more penetration into the population will result in better outcomes of patients. And secondarily, we need to make sure that device synergy is utilized and implemented at a better level, along with guideline directed medical therapy where feasible. Device therapy, which includes your ICD, CRTD, the mitral procedures, the tricuspid procedures, can be utilized concurrently. And we also need policymakers to work with healthcare community to make sure advanced cardiac therapy options are available and trained resource personnel are available at public hospitals, and it is only then that you can see a heart transplantation program moving leaps and bounds in our country. Thank you.